The urine analysis test strips for John M. shows the following results. The color was yellow, the clarity was clear, and the specific gravity was at 1.030, and his glucose was 120 milligrams, and his ketones was 40 milligrams, and he was negative for leukotyne esterase. Sorry if I butchered that. And he was negative for bilirubin. And you're probably wondering, what diagnosis does John M. have? I'll tell you. He has uncontrolled type 2 diabetes. And how do I know that he has type 2 diabetes? Well, he's just showing classic symptoms of high blood sugar, such as excessive thirst, frequent urination, fatigue, unexplained weight loss, and blurred visions. His lifestyle factors include a sedentary job and a high carbohydrate diet are also risk factors for his type 2 diabetes. The urine analysis confirms the presence of glucose and ketones in the urine. When blood sugar levels are too high, the kidneys are unable to reabsorb all the glucose, and it spills into the urine. The body then begins to break down fat for energy, which produces ketones, and these are also excreted in the urine. The high species gravities reading is consistent with dehydration and the high concentration of glucose in the urine.
For patient John's further testing and treatment suggestions. For further testing, a definitive diagnosis requires additional testing, including a fasting blood glucose test, an oral glucose tolerance test, or a hemoglobin A1C in parentheses HbA1c test. The HbA1c test would provide an average of his blood sugar levels over the past few months. For treatment recommendations, the recommended treatment would involve lifestyle modifications, including a healthier diet and increased physical activity. Depending on the severity of the condition, medication such as metformin or insulin may be prescribed to help manage blood sugar levels. He should also be advised to drink more water to address the dehydration that was discovered in the tests. The definition of type 2 diabetes mellitus is a chronic condition in which the body does not use insulin effectively or does not produce enough insulin to regulate blood sugar levels.
Causes: insulin retention, pancreatic dysfunction, genetics, and lifestyle factors. Insulin retention is when the cells become less responsive to insulin, leading to high blood sugar levels. Pancreatic dysfunction is when the body does not produce enough insulin. Genetics: having a family history of diabetes is a significant risk factor that can be ignored. And finally, lifestyle factors like obesity, physical inactivities, and unhealthy dieting all increase the development of type 2 diabetes. Symptoms: increased thirst and urination, excessive hunger, fatigue, blurred vision, slow healing wounds, numbness or tingling in hands and feet. Diagnosis: blood tests such as the A1C, fasting plasma glucose, or the oral glucose test. The A1C test, which shows your average blood sugar level over the past 2 to 3 months, while the fasting plasma glucose test, which measures your blood sugar level after not eating for at least 8 hours. And finally, the oral glucose tolerance test, which checks how your body processes sugar over a few hours after drinking a sugary solution. Treatments: There are medications like metformin, sulfonylureas, and insulin. There are others that doctors may prescribe you depending on your situation. It is also important to monitor your blood sugar level regularly to make sure you stay within a healthy range. Complications: heart disease, stroke, kidney damage, eye problems, nerve damage, and even severe cases, amputation. Prevention: maintaining a healthy weight, exercise regularly, eat a balanced diet, and manage stress and quit smoking. Note: earlier detection and management of type 2 diabetes are crucial to prevent complication and improve overall health. If you experience any symptoms or have family history of diabetes, consult with a healthcare professional for evaluation and guidance.
Understanding type 2 diabetes mellitus. Insulin is a hormone that helps sugar and glucose get into your cells to be used for energy. When your body doesn't respond to insulin effectively, or there isn't enough of it, glucose builds up in your bloodstream. That leads to high blood sugar levels, which over time can cause serious health problems. Being overweight or obese, not having enough physical activity, having a family history of diabetes, and being over the age of 45 are some common risk factors for type 2 diabetes. Many people don't notice symptoms at first, but when they do show up, they can include increased thirst and frequent urination, feeling hungrier than usual, fatigue or low energy, cuts or sores that are slow to heal, tingling and numbness in the hands or feet, and blurred vision. So what causes it? Type 2 diabetes is usually caused by a combination of genetics and lifestyle choices. If it runs in your family, your risk is higher. And being inactive or carrying extra weight, especially around the belly, can also make you more likely to develop this. If your levels are high, it could mean that you have diabetes. The good news? With the right approach, type 2 diabetes can be managed, and many people live long, healthy lives with it. Thanks for watching, and remember, knowledge and early action are powerful tools in preventing and managing diabetes.